this is Dr. Jared Garris. I'm the Glynn County Health Officer, and I'd like to speak for a few moments about COVID-19 and schools. Today's date is June 29th, and we have spent over a 2-hour-long meeting with the superintendent of schools discussing about some of the changes and some things that might be a little bit different about school, and kind of problem solving how to try and make it as safe as we can and yet try and make school as normal as possible. And so I'd like to talk for a few moments about what some of those changes are going to be like, and try and get that information out to the parents and students so that they can have a good idea of kind of what school is going to be like. From my perspective, my mom was a teacher. I'm very in favor of education. In my mind, the worst thing that's happened with the shutdown of the businesses and schools and everything has been the tremendous impact that it's had on the youth. For many, when school stopped, all education stopped for them. Unfortunately, sometimes school is not, home is not a very safe place for kids, and school really is. And unfortunately, we probably have some kids that are a little bit in danger out there. Socialization, I think that it's incredibly important for kids to be around their peers, and emotional health, and especially with all of the turbulence and disagreement that's going on, and then when the youth don't have their social support, I think it makes it extra hard for them. Having said that, I also am a firm believer that we need to do what we can to keep people as safe as we can. What do we know about COVID-19? First off, it's not nearly as deadly as we thought at first, which is fantastic news. And to be honest, we are learning things as time goes on, and it is making it so that that number of people, the percentage of people who end up dying from COVID-19 is only going to continue to go down. Having said that, the medical literature is pretty clear that 10-20% of people will end up with COVID-19 who get test positive for COVID-19 will end up needing to be hospitalized. And so, and we'll kind of go over what that's looked like in Glynn County. But it has a significant morbidity, or there's a lot of people who still get sick even when they don't die. There was a Kaiser study, not a huge one, but 1,277 hospitalized COVID patients. The average length of stay in the hospital was 10.7 days. 42% required the intensive care unit. More than a quarter of them spent more than 16 days inside the hospital. So those are people who get pretty sick. In our county, we've had somebody who ended up needing to be put on a ventilator, so they were in the intensive care unit for a couple of weeks. They were in the hospital for more than a month, and of course with that goes a lot of rehab. The total bills are going to be over $200,000. So a lot of bad things that can come from COVID-19. So not nearly as much death, but there is a lot of sickness and potential long-term complications that can be associated with COVID-19. So we want to try to do what we can to try and minimize the spread. This is, speaking of spread, this is what Glynn County's graph looks like. So you can see that it started slow, and you can see that it's logarithmically or exponentially grown. So this was from Fridays, and so now we're up over 100. But you can see that clearly we're having a lot of increased cases. And there'll be lots of things that we talk about in this video that can help decrease the spread of COVID-19. This is looking for residents of Glynn County when they've ended up getting, when they've ended up testing positive for COVID-19 and kind of what's happened to them. So the vast majority, 75%, have been able to stay home and not need to be going to the hospital or anything like that. Asymptomatic, 15.6%. So really the studies show that should be more like 25%. So that probably means that we're not quite getting as much testing. As I mentioned, our hospitalization rate here in Glynn County is actually a little bit down right now. I don't know if that's going to bump back up or how that's going to be. And early on, we were running well above 20%. Now we're just a little bit above 10%. So 11% have needed to be hospitalized. We've had 5 that have gone into the regular hospital rooms and 4 that have required going into the intensive care unit. So that's That's what it looks like for Glynn County thus far. This has to do with us tracking and figuring out whether or not we can figure out where people contracted COVID-19. And you'll notice that 92% of the time we're able to figure out where people get COVID-19. We've got some people who are really great detectives at the health department, and they keep asking, and 92% of the time we're able to figure that out. Only about 8% do we not. Okay. So we've got a good idea about how it's spread. And it's kind of interesting. When we look at all of the cases and what they have in common, that 92%, close proximity, less than 6 feet apart, and for more than 15s, and no facial covering. Every one of our cases falls into that category. Kind of interesting, isn't it? Not overly complicated. I mean, if we can stop this, 92% of our cases go away, potentially, or it goes way, way down. These are important things. These are important things. And so we're going to be incorporating that into the new school and how things will be a little bit different. Because you think about it, how often do students spend more than 15 minutes together at less than 6 feet apart? And you think about a student with a bunch of other students around, and each class, how many, if you have one student, how many potentially could they infect if you just drew a 6 feet circle around them? It'd be a lot. It'd be a lot. So how is the SARS-CoV-2 spread, or COVID-19, how it's spread? And its respiratory droplets are the primary mode of transmission. So respiratory droplets is when we cough, when we sneeze, when we speak, when we even breathe. We send out these little particles out into the air, and those particles end up landing in people's eyes. Or we breathe them in and it gets into our lungs. And that's the two main places that we have the receptors for that virus to get into our cells, is in our eyes and in our lungs. Okay, and so we'll kind of talk about that some more. But that is hands down, clearly the most common way that COVID-19 is spread. I love this picture. So this is kind of a famous picture from the CDC. You can see this guy coughing, and you can see all of these respiratory particles. And you can just picture how these could be full of COVID-19 virus, right? Or the coronavirus. And you can see how this guy coughing could just send a whole bunch of those particles to me and end up making me sick. And actually, I'll just a little bit, we talk about that 15 minutes. What we think is that you have to get enough of the virus in before it actually triggers you to get sick, okay? And that's kind of true for almost all infections. It's not just, one virus particle that, that ends up making somebody sick, or even one bacteria. There's a certain amount, and then that's enough when you finally get sick. And that 15 minutes is those repeated exposure to the virus until you get enough of it in that it ends up making you sick. And it's thought that the more of that you get, it ends up the more sick you get. That's what we think. But you can see how if this guy coughs and it hits me, how this could be a one shot. I just got a whole bunch of exposure to coronavirus, right? Now I want you to think for a second, instead of this guy coughing with nothing covering his face, what happens if he coughs into his elbow, right? There aren't going to be nearly as many particles, right? What if we go one step further and we go ahead and we put a mask on him? How many of those particles are going to come out? It's not going to be nearly as many. And when you have a mask, I encourage you to go ahead and try this. Try blowing on your hand with a mask and without a mask. And it's a great way of just really understanding how much a mask can make a difference for decreasing the spread of that breath. We've been saying for a long time, so if we put a mask on him, he protects me because he doesn't send those respiratory particles to me, right? And if I wear a mask, I protect him because I don't send those respiratory particles to him. If we're all wearing masks, then we're all protected, right? Kind of makes sense. Mandatory masks. Unfortunately, that is going to be something that is going to be part of the new school year. I really wish that it wasn't. Reality is, though, is there's pretty good data, and I'll kind of go over some of that with you as to why masks help protect people and why the state of California has made it such a big deal that masks are mandatory. This is a screenshot of an article that's talking about a study. The study was published in Lancet's June 1st. And what they did was they scoured the world for all of the studies as far as for transmission rates with and without protective equipment. And I think there was 244 different articles that they read, 16 different languages, tried to get the best data that they could. Now, having said that, it's absolutely not perfect, and there's lots of flaws. But this is the numbers that they kind of came up with. When you don't do any kind of social distancing or physical distancing, the chance of developing COVID-19 is about 12.8%. Now you go ahead and you get 1 meter away, so about 4 feet, that drops to 2.6. So big difference, huh? Big difference. If you extend that a little farther to 6 feet, it even goes down significantly more. And you can actually get onto the study and look at the graph for that. Face masks, 17.4% without anything. It drops down to 3.1% with. That's huge. That's 5 to 6 times less likely of developing COVID-19 by wearing a mask. And the thing that's really great about this study is that it actually shows that the person who's wearing the mask gets the benefit. We've had a number of studies that have shown that when you put a mask on somebody, everybody else is protected. For instance, there was a study where somebody had tested positive for COVID in a family. They put masks on everybody, and it decreased the chance of spread of COVID-19 to any other family members by 78%. So the masks clearly work, and it's kind of cool that it protects both the person who's wearing it as well as everybody around them. And then eye protection. I think that there's a lot of people who don't realize that we can actually get COVID-19 from the eyes. There's a few places where we have, places in our body that we have the cells that have the receptors for taking in that novel coronavirus. And so the main place is in the lungs. The other main place is in the eyes, and then we have some in our nasal passages in the mouth. But the biggest place is in our lungs. But by having some kind of eye protection, whether it be goggles or face shield, they went from 16% down to 5.5. So about a third less likely chance of getting COVID-19 with some kind of eye protection. One of the things they point out is even with all of these things, there's still a chance that you end up contracting COVID-19. But I think that gives some good roundabout data as far as what kind of protection we get when we do those things. I want to talk about screening for symptoms. So one of the other things that's going to be different when school starts is we're going to ask parents to be screening their kids for symptoms before they send them. Because if we send one child to school with COVID-19 and then they end up spreading it to another, and then they take it home to parents and maybe grandparents, you can see how this can just lead to, well, kind of like what we had with that graph, where it just is going up and up and up. Okay, so screening for symptoms. So it's going to be something that people are going to have to do. Now, different superintendents, when we were talking about doing it differently. Some were going to do it at school and make it mandatory. Other were going to have parents do it at home. So there's some variance, but there will be some kind of a screening. These are the symptoms from the CDC. So we've got fever, cough, shortness of breath, chills, repeated shaking and chills, fatigue, muscle pain, headaches, sore throat, new loss of taste and smell. I'm going to stop right there and just talk about this one for just a second because I think it's an important one. UC San Diego has a wonderful study. You can go ahead and read about it. They found that about 70% of people who tested positive for COVID-19 lost the ability to taste or smell. Okay. And there was a large England study that found that the loss of taste and smell was the most common symptom of COVID-19. It's kind of an interesting one, isn't it? And there was another study that showed that about 12% of the time, that's the very first symptom. So people feel fine, they go to drink their coffee in the morning, and they just can't taste it. You have that happen, stay home. That's almost certainly COVID, or there's a high chance that that's COVID, okay? So that's something to really be aware of. Nausea, vomiting, and diarrhea, that's an early symptom as well. And we want to catch it early. Fevers often are a later symptom. Shortness of breath is a later symptom. The nausea, vomiting, and diarrhea and loss of taste and smell tend to be earlier symptoms. And nasal congestion and runny nose. Kind of a lot of stuff to kind of remember. In Australia, they have it a little bit different. So they say if you have cold or flu-like symptoms and loss of taste and smell. And so, you know, you could even just say, if you're sick and you lose your ability to smell or taste, stay home, get tested. So those are going to be the symptoms that we need you guys to be aware of. I'll go ahead and I'll read this and then we'll talk about where this comes from. The main mode of COVID-19 spread is from person to person, primarily via droplet transmission. For this reason, strategy for infection prevention should center around this form of spread, including physical distancing, face covering, and hand hygiene. Okay? So this comes from the American Academy of Pediatrics, getting schools ready for COVID-19. And this is the interesting part. This is the first line under cleaning and disinfection section. This COVID-19 is not easily, to use the words that the CDC uses, by objects or fomite. That's the medical term. When it goes from person to an object to a person, that's called fomite spread. Okay? This is spread by respiratory droplets. It doesn't happen so much from touching door handles and those kinds of things. It can, but that's not the main way that is. This is how we prevent the spread of COVID-19, is physical distancing, wearing a mask, and keeping our hands clean. I mean, that's going to be the crux of it. Now, there will be a lot of things that they're doing high-touch areas. There'll be a lot of emphasis on use of washing our hands and using hand sanitizers, you know, maybe every time going in and out for recess, something like that, because that's going to help decrease the spread of COVID-19. Special areas of concern. So lunches. So lunches are probably going to be different than how they were last year. So when talking to the superintendents about it, some sounded like they were thinking that what they would do is stagger lunches. So they would have them come at different times so that there weren't as many people, right? Because you think about lunches and you think of all of those kids in a real small area, and then what do? They take their masks off because they got to eat, right? And that just being a perfect area for spreading of COVID-19, and usually spend for, you know, at least 15, 20 minutes in there together. And so lunches are kind of a scary thing. And so there's talk about some rotating, talk about having some of them trying to do some things outside when the weather's okay. And I think that some of them are going to have the kids stay in the classrooms where they can be more social distanced. Unfortunately, it's going to be a little bit potentially hard for the teachers. I feel bad for the teachers on that one, and for the kids too. Singing. So singing is a very dangerous thing with COVID-19. So we sing, and the louder we sing, the more respiratory droplets we produce, and the farther they go out. And then after we hit that note, what do? We go, and we breathe them in. Right? And so you can see how churches could, or how choirs could really spread COVID-19. There's a choir that was in Washington. One person came in, they had COVID-19. 87% of the people ended up becoming infected, 53 people. There was multiple hospitalizations and 2 deaths, right? Singing is a dangerous thing. So I'm thinking that musical theater and choir, there's going to need to be some severe changes with that, or just dropping it. And I think it's going to be really difficult to have good sound quality through a mask. I think that's going to be a frustrating thing. So I think probably most superintendents are going to do away with choir. We'll see. We'll see. Band, right? So all of those instruments, they you know, involve blowing, and they're going to be sending those respiratory droplets out. And so that's probably another one that's going to be radically different or done away with. I don't know. We'll see. We'll see how it all plays out. And exercise. When we are exercising, we're sending out those droplets, right? We're breathing hard, those respiratory droplets are going out. So we're going to try and do things where we keep kids outside as much as we can, and we keep them distanced, okay? And so they're probably going to need to be coming up with some different games and things that they play. I don't know if you were aware, but several of the Sacramento Kings players have contracted COVID-19. Being in a gym, running up and down the court in close proximity, you can see how that would spread COVID-19. And then buses, because buses, so with buses, we end up all coming in together, small area, driving down the road, more than 15 minutes, less than 6 feet apart. It's potentially a dangerous thing. So we're going to encourage parents to drive their kids as much as they can. That protects the kids, and then because it's one less person in the bus and allows for more social distancing, it protects those on the bus as well. So, and we're gonna be doing our best with that. And that's gonna be a little bit of a tough one. The other thing we're gonna do is just try and keep the windows open so we get good air circulation to try and kind of dilute out those respiratory particles. So these are difficult times. I wish things were different, but they're not. And this is the time that we're living in, unfortunately. And so we're going to do the best we can with it. I think that the feeling I got from each and every one of the superintendents is that we really want to make school, get all the kids together to have things to be as normal as possible, but to do it in a safe way. And that's the goal of I think probably all of the teachers and everybody is to try and make this thing work. And it's not an easy thing. There's no question about it. But having said that, I've lived in Orland now for almost 16 years and have been practicing in Willows for 16 years. And I know about the people in this community. I know that they can do hard things. I know that even though it's not fun to wear a mask and it's hot, that they can do it for the protection of themselves as well as for the rest of their community. And especially for those little old ladies and things. I know that we can just stay home. Or when we're together, maybe just take an extra step back. That's going to really do a lot for decreasing the spread. And then the other thing is that we can think about our neighbors and when we're sick, not go to work and not go to school. I know that we as a community can do that. Thank you.